Hi, my name is Julie Bond. I'm the president of Bond Consulting Group, and it's my pleasure to talk to Dr. Lowe today from British Columbia. Hi, Dr. Lowe. How are you today?
Hello, hi Julie. I'm doing fine. Thanks for having me here.
And you're from the cSBC. Can you tell us what that organization is?
Sure. I'm the executive director of the Consultant Specialists of BC. We abbreviate ourselves CSBC. And what we do is we strive to represent all BC specialist physicians, both for the fee-for-service and the non-fee-for-service group. So we are an independent organization. We're separate from Doctors of BC, and we're also separate from the individual sections of specialty, which we represent 34 different sections. And with that, we also work collaboratively with the BC Family Doctors, kind of a sister organization that we work collaboratively together. So we're really the only organization in BC that is speaking up for and representing the perspective of specialist physicians in British Columbia.
And that's why we're working together because the medical specialists in Canada are highly eligible for the SR&ED program, and that there's a very low awareness about SR&ED and participation in all areas of Canada, but also in BC. And you wanted to raise awareness about eligibility of the SR&ED program in your province. So you can tell me a little bit why you think that specialists are not claiming the SR&ED program in BC or anywhere else?
Sure, I think there's probably a few different aspects to that. So I'm a healthcare professional who's dabbled in some research, and I've talked to lots of specialist physicians. So there are some that are certainly applying and take advantage of this shred credit, and there are many others that are just completely unaware of it. So either they're too busy and unaware that there is this tax incentive that they're doing research and can get a refund essentially. And also, I guess some folks don't really understand it, so they're a little bit apprehensive. There's so much phishing schemes and scams out there that they feel that this might not be real. And that's why as CSBC, we want to make sure that people understand that we've endorsed it, we've looked into it, we've certainly, I've talked to many of the bond references. So folks that you have as clients, I've had personal conversations with actually more than 6 of them, and they've been very happy with your services. And that's something that we want to get out to our members and to all specialists in British Columbia, that this is, in fact, a real program. And I think it's just the folks are way too busy. And I'd like to say that maybe in BC, we're a little bit more scared once it's involved with CRA and taxes. We just, have so much, sometimes audits that occur in BC, not necessarily in taxes, but with our practice, with payments and that kind of thing. So I believe specialists are a little bit apprehensive to jump into this, and they lack the time to really do the research. And so I think between Bond Consulting and CSBC that we can work together to raise that awareness and to also raise the credibility that this is real and a benefit to the members.
Well, absolutely. I mean, we find at Bond Consulting Group that the participation rate of eligible doctors is anywhere between 2 and 5% nationally, right? So this is extremely low. And this is an entitlement program, and it's sitting right there in their tax returns, sitting right there available to them. If they're incorporated doctor in Canada or in BC, they've had the ability to apply for this program. Can you believe for the last 40 years? And only now the awareness is growing, and thanks to partners like cSBC and, with the tax consultants here at Bond Consulting Group, we can raise awareness and get more candidates applying for their benefits, and it's retroactive too, so they got nothing to lose. So you've heard positive feedback from the members of cSBC and some of them who have also been bond clients. So what are they saying about the SR&ED program now? Is there a little bit more enthusiasm out there?
There's certainly more when they understand it and certainly when they participate. So they are a bit surprised when they do get a refund. So it's not something that they were expecting. And of course, then they feel bad that they haven't been taking advantage of it for many years. Specialist physicians are certainly a group that's always involved in some level of research. And some of them are doing quality improvement projects that also may qualify as research. They may have to do a few extra steps, but it's very close to it. And I think because it's such a small part of their practice, they don't really consider it. But given that they are in a higher tax bracket, there's a lot of benefit that they can have. And I think that's what they're seeing. So when I talk to the physicians, they are very surprised and happily so. And I think the support from Bond Consulting has made it easy for them. If you dive
Mhm.
into something without knowing how to do it, it's like filling out a form. It's just tedious. But when you
No.
have someone, one of your colleagues helping a specialist through it, they are then kind of handheld through the process. It seems to take them less time because then they're getting guidance on what exactly they need to fill out, what they need to capture. And I think through that has made it really easy for them. And therefore, the bang for buck is really great. And they never realized how easy it really is. And, it's been quite consistent that people are receiving a pretty large refund
Mhm.
that they didn't anticipate.
Yeah, absolutely. Well, that's why everybody hires professionals, right? Why you hire a specialty doctor because they know something about a field of medicine that you don't know, and why you hire specialty tax consultants because they know something about taxes that you don't know. Tell me a little bit about more about what cSBC offers to their members, though, just so that we have an idea what your group offers to your members.
Absolutely. So we are a society that's set up initially for advocacy. So we advocate and speak for all specialists in British Columbia. But we've been finding that membership needs to grow in order to get a bigger voice so that we have more of an impact, that we're more recognized, and also get the input from all specialists around BC, especially when there are 34 different sections of
Mhm.
specialty. It's
Wow.
a little bit difficulty in bringing them together. So one of the things when I came on board is to find benefits that are tangible and immediate benefits to our members, and to also then entice membership. Working with Bond Consulting is great. We've developed a program together that offers, a benefit from a discount point of view, as well as a member that there is incentive so that there are good rates, and also and like how you've approached it, where if there's no return or refund for them, there's no fee. So essentially, there's no risk. That's really
There's no risk.
beneficial. And we've
Yeah.
also added other benefits such as health and dental benefits, which are customized to specialists. And we are
Mhm.
searching down and creating other ones. And this is the key. We're customizing the specialist benefits so they fit a specialist practice and what they have and need. And I think that's what's been really beneficial with working with Bond Consulting, that you're creating a program that's really focused on the specialist physician because
Mhm.
they are unique and a special kind of researcher. And same with our health and dental benefits. Their specialist needs are certainly going to be different from other health practitioners as well as from family physicians because their offices are set up differently. And I think with a specialist, almost all of them, of course, are going to incorporate. So that may not be with all healthcare professionals, of course. And, the SR&ED program applies to every industry, as you know. And I think just in healthcare, there's just a lack of recognition that there could be this tax incentive. And us as an organization want to promote that. So we're educating our members and not only providing advocacy now. We're going to have some educational webinars, and I know Bond Consulting will be doing some of them with us to help
Mhm.
educate our members and even bring in non-members, have them learn, and of course, to take advantage of those benefits and special rates to join cSBC.
Well, specialists should definitely be taking advantage of this program, right? So this program is for any business, but MPCs are busy as well. Our businesses as well. We call them medical professional corporations in Ontario. I don't know if you have the same name in BC, but this program rewards any business that achieves an advancement of knowledge in a field of science, technology, or medicine. If that's not specialist, then I don't know who is. But it's hard to learn this program. You need to have experts who can make it easy. Otherwise, you're going to spend countless hours and have so many red flags, and you might get audited and you might get denied, and it's really not necessary. You just hire professionals to take care of it. Not only is it easier, but your refunds are going to be completely legitimate and with minimal time investment. Let the professionals take care of it, right? And the same way that we go to seek out the advice of specialists when we need specialists, like the specialists in your organization. So how do people contact you if they want to know about more about the cSBC and the benefits you're offering to specialists in BC?
So we are circulating a brochure that describes a bit about this program. folks can contact me as well, and they can find contact information at our website, which is specialistsofbc.org. And there we will have a landing page and a link that will bring them to, I guess, a shared collaborative website, microsite that will give them additional information. And I think you've even created something where they can do a booking right there and then.
Right.
So I think it's very easy for them to access. And we've been going out, I guess, to different meetings and also promoting and educating folks on this. And, you know, one of the things I would like to point out, the incentive of the SR&ED credits, not only to get that tax refund, but it's encouraging scientific research and development, which is what it was set up for. And I know many of the specialists out there, including myself, who's dabbled in research, you don't oftentimes, I guess, take it to the point of publishing it or finishing off everything. You kind of do it as an internal project, which is really research, but it doesn't get out there. And I think what this program does is it gets you to finish off those few steps, and then you get a payment or a incentive to do so. So getting it to that publication step, I think this is what this program does, is it incentivizes you to get it out and publish, because then it makes it so much easier, as I understand it, to get that refund.
Well, the publication doesn't hurt, but it's not a requirement of the program. So even if you do internal studies on your own client base or patient base, even if it's private, seeking out trends or relationships between biomedical factors just for your own professional knowledge, even if it's not published, it's eligible for the SR&ED program. So we're going to be doing more webinars for your members, and we set up a landing page as well, shreddoctors.ca/CSBC, for any of the doctors in the BC who want to find out more about your organization, about our organization, about the benefits that you're offering, and about the SR&ED program for tax refunds for specialists in BC. So I wanted to thank you for spending some time with me today, and I look forward to doing more awareness for specialists and doctors in BC to get the word out about the SR&ED program. So thank you so much for your time today.
Thank you very much, Julie.
Thank you.